Mr. Jones, I understand that you have a long history of uncontrolled hypertension. I wanted to explain to you exactly what this means. Primary or essential hypertension is most likely the result of numerous genetic and environmental factors that affect the cardiovascular and kidney structure and function. A few of these risk factors include age, obesity, race, high sodium diet, family history, excessive alcohol consumption, physical inactivity, social determinants, and insufficient sleep. Secondary hypertension is caused by medical conditions that can affect blood pressure. A few of the major causes of secondary hypertension is due to prescription or over-the-counter medications such as non-steroidal and anti-inflammatory agents, antidepressants, corticosteroids, antacids that contain sodium, stimulants, and atypical antipsychotics, just to name a few. There are conditions that cause secondary hypertension, such as Cushing's syndrome, certain endocrine disorders, and coarctation of the aorta, illicit drug usage, and even obstructive sleep apnea. Complications of hypertension include heart failure, stroke, heart attack, and even chronic kidney disease. A normal blood pressure is a systolic measurement of less than 120 and a diastolic measurement of less than 80. After informing you of the different types of hypertension and how they're developed, as well as the complications hypertension can cause within the body, I wanted to let you know that this diagnosis is luckily something that we can control. From the information that you've provided for your medical history and background today, I wanted to discuss a few changes that can be made to your daily schedule that will assist in managing your blood pressure. I understand that lifestyle changes can be challenging, but doing so will help achieve a maintained blood pressure level and decrease your risk for any further complications. These modifications will benefit your shortness of breath that you experience with the activity, like climbing up the stairs as well. Adding in at least 30 minutes of physical activity for at least 5 days a week, reducing the amount of alcohol you consume daily, reducing your weight, and attempting to become more aware of the amounts of sodium, fats, and carbohydrates, and limiting them in your diet are all modifications that should be made. If necessary, we can incorporate medications to decrease your blood pressure as well. You have already stopped smoking cigarettes, which is a great accomplishment, but adding these modifications will be extremely helpful to your overall health as well. While I don't want to scare you by providing this information, I do want to ensure that you're aware of the possible complications if you do not begin to take your blood pressure seriously. Stroke is most commonly caused by high blood pressure. A stroke happens when a blood vessel carries oxygen and nutrients to the brain and is either blocked by a clot or it ruptures. Treatment for stroke relies typically on prevention. In your case, prevention of this includes maintaining your blood pressure within normal levels. A stroke is referred to as multiple different names, so if you ever hear any of these, such as a cerebrovascular accident, or a CVA for short, brain attack, hemorrhagic or ischemic stroke, and even many episodes referred to as transient ischemic attacks. The main symptoms of a stroke include sudden weakness or numbness, typically on one side of the body, sudden changes in balance, blurred or double vision, facial drooping on one side, slurred speech, and or inability to speak. It's important to know these signs and symptoms if you ever experience any of these, so you'll know to call immediately for medical assistance, because early treatment for stroke is best.